State officials are preparing to start their regular Friday coronavirus briefing. Let's listen in live now to Montpelier.
As well as Deputy Secretary Samuelson and Dr. Levine for our usual vaccine and health updates. This afternoon, we'll also be paying very close attention to the advisory committee discussion about the Johnson & Johnson vaccine. It's my hope that after the committee finishes its meeting, the CDC and FDA will move quickly on their recommendations, perhaps even tonight or tomorrow. In Vermont, we're preparing for a resumption of the use of these vaccines, so we're ready if all goes well. If the feds give the green light, we'll be ready to start using J&J again next week, which will be helpful in so many ways. But I want to assure everyone, even without the J&J, we're still on pace to have more than 60% of adult Vermonters vaccinated with at least one dose by May 1. If the pause is lifted, it will allow us to further accelerate. So I want to thank Vermonters again for doing their part in signing up. Among many other things in this pandemic, Vermont is a national leader in both rate of vaccine administration and the percentage of our population being fully vaccinated. And that is because of all of you, and thanks to all of you, helping yourselves and your communities by getting the vaccine. We're really fortunate to have all these choices, all these vaccines that are safe, effective, and will allow us to do many of the things we've missed over the last 14 months. Next, as you'll remember from last week, Senator Sanders and I talked about our work to expand summer programs for our youth. Together with the Agency of Education, Vermont After School, and others, our goal to make sure kids can reconnect with their friends and have some fun this summer after missing out on so much over the last year. This week, Senator Sanders and I met with superintendents from across the state to hear about their plans, and I was really encouraged by what I heard. I want to thank them for working with us to help build a great summer for our kids. For parents out there looking for opportunity for your kids, you can view a map of available camps on vermontafterschool.org. So far, there are over 400 offerings listed, with more on the way, and that's enough capacity to welcome over 30,000 kids. We're working to make these programs accessible, affordable, and impactful for our youth, so please take a look if you have an opportunity. One obstacle we heard about from the superintendents, and this is true for many sectors, is staffing. There are currently many full and part-time positions available this summer across the state. The more people our summer programs can hire, the more kids we'll be able to reach. So this is a great opportunity to step up for our youth and spend the summer having some fun. Vermont After School has a full page, has a page for people interested in these jobs. This is open to high school as well as college students looking for a summer job or college credits. And it really does bring back memories for me. When I was 15, I was a camp counselor at Lotus Lake Camp as a woodworking instructor. So again, if you're interested, visit vermontafterschool.org. Lastly, ACCD will issue our full summer camp guidance within the next 24 to 48 hours. And we'll discuss it at Tuesday's press conference in greater detail. But stay tuned for that. Look for it. It will be up on their website over the weekend. With that, I'll now turn it over to Secretary French for his education update. Secretary French.
Thank you, Governor. Good morning. I'll begin my update with a review of the PCR surveillance testing in our schools from this week. This was vacation week for some of our schools, so the participation rate was much lower than normal. This week, we tested about 226 staff, which is about 20% of the number we usually test. To date, this testing has identified no positive cases of COVID-19. This is the third week in a row the testing did not identify a single case. This means the positivity rate for school staff has been 0% for the month of April so far, and the state positivity rate remains low at 1.5%. With the vaccination of school staff nearly complete, we have decided to end the surveillance testing program for school staff after next week. In its place, we are working with the health department to organize a pilot surveillance testing program for students in schools and summer programs. We'll be using new funding from the CDC to pay for the program. This program is still being organized, and we'll have updates on it in the coming weeks. The USDA announced this week that it is extending program flexibility for the student meal programs through June of 2022. This will enable schools to operate these programs next year in response to changing conditions of the virus, and will also provide additional financial subsidies. We are in the process of understanding the specific implications of this announcement, and we will follow up with additional guidance and communications as we get more information. Our initial reaction is this is welcome news and will certainly help support the food security needs of our children during what has been a very challenging time for many of our families. On a similar note, we received the first guidance on ESSER III funds from the U.S. Department of Education yesterday, in the form of an interim final rule that describes how the funds need to be administered. The ESSER program has been the primary vehicle for federal K-12 relief during the pandemic. Vermont's K-12 education system will receive about $285 million under this ESSER III program, with 10% of the funding being reserved for state-level support and 90% going directly to school districts. In the guidance that was issued yesterday, the U.S. Department of Education clarified that the Agency of Education is the recipient of these funds, and the agency is responsible for developing a plan for how to spend the state-level funds. We will now begin the work of developing the spending plan. The agency is required to develop the plan through a formal process of stakeholder engagement and public comment, and we will use the priorities that emerge from the district-level recovery planning guide to guide the initial drafting of our plan. Lastly, we will be issuing guidance on graduations and end of school year celebrations this afternoon. Both graduations and end of school year celebrations, including proms, will be permitted, but will need to follow the safety requirements outlined in our Safe and Healthy Schools guidance and the Vermont Forward Plan. These celebrations are not only being permitted this year, but also being strongly encouraged. This has been a long year for our students in our schools, and we want to do whatever we can to ensure the school year ends in a safe and celebratory way. That concludes my update. I'll now turn it over to Deputy Secretary Samuelson.
Good morning. I'm Deputy Secretary Jenny Samuelson of the Agency of Human Services. Today I will provide an update on the progress with vaccinations. As it's already been mentioned, the CDC's Advisory Committee on Immunization Practices is meeting today to review the data on the Johnson & Johnson vaccine. We hope to have more information later this afternoon, but during this pause, we have been watching closely and planning. Depending on the outcomes of the Advisory Committee, we could begin vaccinating as early as Tuesday in the Northeast Kingdom. If a recommendation comes out this evening, we'll likely have more specific information to share on Vermont's plans as early as Saturday morning. I am happy to share that we have reached another milestone this week. More than 300,000 people have received at least one dose of the COVID-19 vaccine. We are making great progress, and at 56% of eligible Vermonters vaccinated with at least one dose, we are closing in on achieving the second steps in Governor Scott's Vermont Forward Plan. I also want to let you know that on April 29th, we will open registration to out-of-state college students and part-time Vermont residents. You can make an appointment on the state's website at healthvermont.gov/myvaccine. If you are unable to sign up online, you can call 855-722-7878. Turning to BIPOC Vermonters, we continue to make good progress. As of today, 52% of BIPOC Vermonters have been vaccinated or have made an appointment. In terms of our overall progress, as of this morning, 305,100 people have been vaccinated against COVID-19. 94,900 people have received their first dose of vaccine, and 210,200 people have received 210,200 people have received their first and last dose. In closing, it's critical that we all do our part to end this pandemic. I want to encourage those who have not yet made an appointment to get vaccinated to do so as soon as they are able. At this time, I'll turn it over to Dr. Levine for the health update.
Thank you and good morning. Our data continues to move in a very positive direction as we are seeing more consecutive days where daily reported cases are under 100 now. We've seen about a 36% decline in cases in the past 2 weeks. Hospitalizations remain relatively stable at 26 today, with 5 people in the ICU. Our positivity rate has dramatically decreased to 1.2%. So while illness among anyone is always a concern, we do appear to be on a better overall trajectory at this time. We continue to see 2 powerful forces at play in our pandemic landscape: variants of the virus and vaccination. As you know, they're working in opposite directions, both here in Vermont and nationally. And despite the good news in our case data, we cannot let up on our efforts to vaccinate Vermonters as quickly as we can in preventing spread of the virus. Across the U.S., the B.1.1.7 variant continues to represent an increasing proportion of the circulating virus. The CDC estimates that it accounted for nearly 45% of circulating virus in the 2 weeks ending March 27th. Although our numbers in Vermont are too small to calculate the proportion of B.1.1.7 with certainty, well over 50% of the specimens that we've sent for whole genome sequencing are returning as this variant. We've also seen the B.1.429 variant in several Vermont counties, and the P1 variant was also recently confirmed in a small number of Rutland and Windham County residents. Speaking of these variants, though, if the B.1.1.7 and B.1.429 were able to evade the vaccines to any significant degree, I would expect increased transmission of the virus. But we are, of course, seeing the opposite right now, a cause for cautious optimism. And this is a great time to remind unvaccinated Vermonters and those not yet fully vaccinated who have traveled out of state to obtain a test within 3 days of their return. Test opportunities are widespread and readily available. As you just heard, on the vaccine front, we're now over 55% of Vermonters 16 and older having received at least 1 dose of vaccine, and 38% who've completed vaccination. I continue to be quite proud of this progress and thank each and every Vermonter who's protecting themselves, their families, and their community. As I've noted before, we are now at the time in the vaccination effort where the impact on cases should become apparent and seems to be doing so. Now that everyone 16 and up are eligible for vaccination, I hope you'll join me in helping anyone you know who may not have made an appointment yet to do so, especially in our younger groups where we would like to see even more uptake. Maybe you're concerned about side effects and need encouragement, so talk to a trusted healthcare provider. Or if you haven't yet found an easy time or location, maybe you need childcare or a ride. Or you might still need a meaningful reason for yourself. Because although many of us have shared experiences during this pandemic, we all still have personal reasons as to why we might get vaccinated. To feel safe, to restart our social lives, less financial stress, or to protect our children, or any one of a number of reasons. Or maybe you are waiting to see what happens with the J&J vaccine which I've been hearing from a lot of people regarding just that point. I fully expect a definitive decision today. The meeting of the ACIP began about 25 minutes ago and will be ending at the end of the day, followed shortly thereafter by FDA and CDC decisions. We will be preparing guidance for Vermonters and for Vermont clinicians this evening. And if there are no major stipulations on who should be offered the vaccine, we will then develop even more opportunities for how to access this vaccine, including the opportunity referred to by Deputy Secretary Samuelson in Essex County. Whatever the case may be, we can support one another and keep improving our reach to more Vermonters, because every person who chooses to get vaccinated brings us all a step closer to moving past the COVID-19 pandemic. Finally, I'd like to end on a somewhat different note, one that I've raised at various points in the pandemic regarding substance misuse. Throughout the pandemic, we've continued efforts to meet all ongoing public health needs. And COVID-19 has certainly created unique challenges for people with substance use disorder, including isolation and mental and emotional pressures that contribute to their disease. So I want to remind everyone, in a spirit of prevention, that tomorrow is Take Back Day, something we made a big deal of many times in the past, and I don't want it to be overshadowed by the pandemic. More than half of the people who misuse prescription drugs get it from a friend or relative, often straight out of the medicine cabinet. If you no longer need your medication, please do your part and dispose of it safely. Take a few minutes this weekend to go through your medicine cabinets and safely dispose of unused and unwanted prescription and over-the-counter drugs, especially prescription painkillers. This simple act makes a huge difference in preventing misuse and diversion. Please visit healthvermont.gov/doyourpart for more information about take-back disposal sites near you, as well as to request a free medication mailback envelope. You can get that from us at the health department. You can often get that in a pharmacy. It allows you 365-day-a-year opportunity to get rid of unused and unwanted medications. And as always, help is available when and where you need it. If you or someone you know is struggling with substance use, visit VermontHelpLink.org. That's VTHelpLink.org for support and referral services. I'll turn this back to the governor now.
Thank you, Dr. Levine. Now I'll open it up to questions.
All right, starting with Calvin Cutler, WCAX.
Thanks, Governor. So you may have seen today that New York City is opening up vaccination appointments to walk-ins. You don't have to have an appointment. And in some states, they're actually asking for fewer vaccines because the uptake isn't as high. So I guess my question is, are we seeing the demand slow down in any counties here in Vermont? And if the J&J vaccine goes forward as well, what do you envision the demand looking like for that?
Yeah, there are certain areas of our state that have either slowed down or never had the uptick. That's why we've concentrated, for instance, on the Northeast Kingdom. That's why if the vaccine, the J&J vaccine is approved, the pause is lifted this afternoon, we'll be concentrating more first on the Northeast Kingdom. Other areas are seeing a high demand still. In some respects, I don't know if that's good news or bad news, but I'm going to take it as good news because we still have a lot of folks that want to have to be vaccinated, and that's what we're striving for. Other states, talking with other governors, they really are struggling to find enough people to meet the supply that they're having come in their doors. So they're in the uncomfortable position of turning that away. We're not there anywhere near that at this point, but it's going to come to that pretty soon. Again, when you look at our numbers, I mean, we're as far as the administration of the vaccine and the policies we've adopted, puts us in the top 3 to top 5 consistently in a number of categories. So we're doing something right, and Vermonters are doing something right, but there may come a time when the supply is going to overwhelm the demand, and then we'll be adopting similar policies. We're starting to talk about that now to be prepared so that we might have some walk-in opportunities and so forth. But right now, today, we're in pretty good shape, and the registration process is working well.
And then I guess my second question, I think, might be either for you or Secretary French. You know, the state, as you mentioned, is putting together this continuity of learning plan for the summer. So I'm just kind of wondering, you know, number one, what will that look like? And what will it cost families as well? What will be the average cost for some of these camps?
Well, again, as Senator Sanders has consistently said, and he was able to funnel money for these programs. That's why we're speaking with some of the superintendents as well, to use some of the funds they had to initiate this. It was pointed towards summer and after-school programs. So our goal is to have it either be free or a small amount of money. But we want to make sure that it's accessible to the majority of kids, regardless of their zip code, regardless of their the means of their families. We want them to take advantage of this because it's really important. We've said this consistently. Getting kids back in school for in-person instruction was about the social needs and mental health of our kids. Same is true here. We want them to have some sort of a normal summer and then transition to in-person instruction by fall. And a number of schools at this point in time, after the break this week, will be going back to more remote or more in-person learning. So we're encouraged by that sign. I'll let Secretary French answer further on that point in terms of what we're seeing as we move forward.
Yeah, thank you, Governor. Yeah, there's a lot of activity going on now in this area, particularly as a part of the recovery planning process, but particularly focused on summer. And to your question, we have sort of parallel things going on in terms of planning. On the one hand, we have the recovery planning that the school districts are engaged in, and that's a result of planning for the next phase of the pandemic, but specifically about how to utilize the federal funding that's coming into the state. On a sort of a parallel track, we also have coordinated activity happening at the state level, and this is through Vermont After School, to expand the capacity of programs statewide. So there's more options for students and families across the state that include not only schools, but summer camps and so forth. We just want to ensure that there are a large number of activities available for all students this summer so they can get outside, reconnect with their communities and schools and so forth. So that's sort of the overarching construct. Right now, again, to echo the governor's observations, I think it's been a tremendous success so far. I mean, things are really coming together very well. Things are moving in the right direction, so we couldn't be more pleased with the support from schools and the community stepping up. And Vermont After School's been wonderful and sort of leading us. So I think it's going to be a great summer.
Just one last follow-up question, Secretary. Do you envision every single student moving on to the next grade, or do you think some districts might make the decision or have kids stay back and repeat grades?
Yeah, that's a question that's really handled at the local level. School districts are required to have a policy on retention. For example, certainly this policy was more typically enacted in a way prior to the pandemic, and you can imagine how that plays out differently at the different grade levels. So, decisions on retention for students in the primary grades, for example, are fundamentally different than the decisions around retention for students at the high school level, which is largely based on passing courses and making progress towards meeting graduation requirements. So those kinds of issues are all being sorted out at the local level, which is where they should be sorted out. And we haven't heard a lot of conversation yet around particularly progress towards high school graduation, but I expect that conversation will emerge here in the next week or so as districts come back from their April vacations.
Steve?
Given the fact that we're probably going to hit 60% between now and next weekend, where are we at possibly for outdoor events and masking wise for spectators and parents and such? Are we looking at changing that guidance a little bit?
Yeah, I think I mentioned that either on Tuesday or last week, that we are looking at how long of the outdoor masking will be required. So I think you can expect sometime in the next couple of weeks that we'll have some guidance on that. We're not quite there yet, but we are certainly talking about that right now.
Liz, NBC5?
I know we're still waiting for a word on Johnson & Johnson, but if we get the green light from the CDC and the FDA, how soon do you think you'd be able to administer shots? Because I know of a couple people who have appointments on Monday. At this point, do you think those people will be able to get the J&J if we do get the green light today?
It will be close. I don't know if it will be Monday, certainly Tuesday, but maybe Deputy Secretary Samuelson will be able to answer that.
So for the few appointments that we still have in the schedule, they are mainly with our pharmacy partners. Our pharmacy partners will need to look at and respond to the guidance that comes out this afternoon. It is anticipated, as the governor said, that we definitely will be ready to go on Tuesday. Depending on what the guidance is this afternoon, we'll be able to make decisions with our pharmacy partners about those that are scheduled on Monday.
And then I do have a question for Dr. Levine. We spoke to a person, a woman who claims just 5 days after she received her first dose of the Pfizer vaccine that she had to go to the emergency room, and from there she was diagnosed with Bell's palsy. Have you heard of this reaction, and do you recommend that this person skip the second dose or continue to go on
Tuesday?
Yes, so Bell's palsy has been reported, not just with this vaccine, but with vaccines for a variety of diseases over the years and decades. So it's not an unknown side effect. Whether her side effect is related to the vaccine or another factor, she would have to investigate with her healthcare provider, because there are a number of other known causes of Bell's palsy. The reality is, if it is related to the vaccine, it is a distinctly uncommon side effect and would not be seen in huge numbers in any of the trials that have been ongoing to date. I wouldn't want to advise her on the second dose, again, because she needs to be assured by a healthcare professional who knows her case specifically that there is no other cause except potentially the vaccine before she makes a decision about the second dose. Someone like her, though, if it were actually associated with the vaccine, that would still not potentially preclude her from getting another type of COVID vaccine. But I'll leave it at that.
Thank you.
Lisa, DAP?
Thanks. This is also a question for Dr. Levine. As I'm sure you know, the Washington University released that study yesterday about the increased risk that COVID survivors, even who had mild illness, face months after they've been sick. I was wondering, is the health department monitoring or plans monitoring COVID survivors in Vermont for any lingering illness or for deaths months later? I know you already have plenty to do, but I was wondering about that.
Yeah, no, thanks for the question. And the CDC came out with information that I guess is going to be embargoed for a short time, but it's probably available this afternoon, that also speaks to what impact having COVID has. So this allows me to repeat a theme I've mentioned many times here, which is to those who think, well, I don't need the vaccine. If I get the illness, it's not a big deal. It'll be done and over with, and then I'll still have some immunity. These kinds of studies remind us that it is not always a benign condition. It is not always something that has no long-term ramifications on someone's health. The description of the people that were observed in these studies are that they had not very significant cases of COVID. They were oftentimes very mild. Yet, when you look at their healthcare expenditures, look at their times to revisit the healthcare provider community, they were at higher rates than you might expect after having had such a benign illness. Some of them had more chronic symptoms that developed as well. I don't want to emphasize death because that was not as significant a finding with regard to these kinds of patients that I'm talking about. So my word of caution to Vermonters, especially those who might feel like they may not really need the vaccine, is do not underestimate this virus. And don't underestimate the fact that you could have long-term symptoms. Now, with regard to what the health department's doing, most of our interactions with a person who tests positive occur very immediately, and then we allow them to have communication with us and encourage that through either the SARA Alert app that we provide or other means during the ensuing weeks. Certainly if they develop symptoms they're concerned about, if they don't lose any of their symptoms and are wondering how to reintegrate back into work and etc. So we communicate with them then. We don't actually follow them long term. However, that's been one of the reasons I've been pushing very strongly for our own within Vermont study of people long term with COVID. And we're very close to beginning that study in a more prospective way now to understand this whole syndrome called long COVID or long haul COVID, depending on what label you'd like to use, which is not everyone. Some people have symptoms and they go away after 3 or 4 months, but these are people whose symptoms persist 3 months plus and don't seem to go away, whether they be fatigue, shortness of breath, exercise intolerance, brain fog as it's called, or other symptoms. So the bottom line is we're going to be embarking on some study of that, but we don't have a lot of data regarding the people who've had COVID already in Vermont and how many of them do or do not have persistent symptoms. I did have an opportunity to speak with a support group a couple of nights ago, and there were people there, obviously, and they had very compelling stories to tell, but at the same time, it was not a large group. That's not totally representative of the whole Vermont population, I realize, but we're not aware of large numbers of people who feel that their symptoms are persisting. But clearly we know that there is a number of them out there, and we want them to be able to turn to aspects of the healthcare community to have their stories heard and have any interventions provided that could be useful for them.
Okay, and then also, thank you for that. You mentioned earlier that you'd like to see, or the health department would like to see more young people get vaccinated. What is the percentage now, and what would you be comfortable with seeing? I'm sure you'd like to see them all get vaccinated, but is there a certain percentage that you're looking for?
Well, we've set a goal for most of our age strata, if you will, in the 80% plus range. And that's how we've been doing a lot of our projections. I think the most recent group that we opened up in that window over the weekend that passed already was the 16, 17, and 18-year-olds. And I think we're in the 55% range or so of them. Is that true? 41% range of them. And then in the next strata?
I'm sorry, Dr. Levine, it's 50% in the 16 and 18.
It is.
41 in the 19.
Okay. 50% in the 16 to 18, and 41% going up to age 29. So certainly
Okay.
and I do know we have a number of people in that latter age band that are awaiting Johnson & Johnson. So we will see with great interest if Johnson & Johnson is returned to its former status with no major restrictions or concerns, how many in that age group are joyous about that and immediately start scheduling appointments.
I see. Okay. Thank you very much.